there, I'm Kaylee. I'm going to be your nurse today. Do you mind verifying your name and your birth date for me?
Yeah, Peyton Graham, November 20th, 1998.
Hi, Peyton. And why are you in here with us today?
My ankle has been bothering me.
Oh, I'm really sorry to hear that. All right, I'm going to put my name up on the board for you, just in case you need to get a hold of me later. So I just need to ask you a few questions to get kind of your history. So once again, can I please have your name?
Peyton Graham.
And can you tell me what today's date is?
September 19th, 2019.
Okay, and your social security number?
3333333.
Awesome. And your date of birth one more time.
November 20th, 1998.
Can you tell me what your height is?
5'5",
And your weight?
125.
Awesome. And your biological sex?
Female.
And are you single, married, divorced, or widowed?
I'm single. Well, I'm not married, but I have a boyfriend.
Okay. And as far as education goes, where are you at right now?
I'm in college right now. I'm a junior in college.
And what's the last year that you have completed fully?
Sophomore year of college.
Awesome. And are you currently working?
No.
Okay. School and work is a lot to do anyway. And you said that you were in here today because of your ankle? Okay. And which ankle was that be?
That's my right ankle.
All right. And when you're feeling that, is the pain really sharp, abrupt? Can you put weight on it? Not?
It's really sharp when I put weight on it, but otherwise it's just kind of like a dull. Doesn't really bother me that much.
Okay. And so for some of your past medical history, I'm going to list off some things and tell me that if you've experienced it with a yes or a no.
Okay.
Arthritis?
No.
Cancer?
No.
Depression?
No.
Diabetes?
No.
Epilepsy, seizures?
No.
Heart problems?
No.
Heart surgery?
No.
High blood pressure?
No.
Psychiatric disease?
No.
Stroke?
No.
Or thyroid?
Nope.
Have you had any previous surgeries?
Just my wisdom teeth.
Okay. And have you had any serious injuries in the past?
I dislocated my shoulder, but I don't know if that counts.
When was that?
I was in the 6th grade.
Okay. And you haven't had any issues with that since?
Sometimes it's sore, but
Okay.
otherwise.
And are you currently taking any medications?
No.
All right. Do you have any allergies that we need to be aware of?
Just Bactrim.
Okay. What happens when you take that?
I get a rash.
Okay. Or do you drink alcohol?
No.
Okay. Do you smoke?
No.
Consume caffeine?
Yes.
How much about a week?
I'd say like 2 cups a day, so 14 a week.
Okay. And do you do any recreational drugs that we need to know about?
No.
And are you on a special diet? Okay. And have you previously received any mental health services such as psychotherapy, psychiatric services, anything like that?
No.
Good. And you haven't been experiencing any overwhelm, grief, sadness, or anything lately?
No.
Good. And you don't have any anxiety or panic attacks or phobias?
No.
And you're not experiencing any chronic pain outside of your ankle, correct?
Correct.
Awesome. Are you in a romantic relationship? You said you had a boyfriend? And how long have you guys been together?
About a year and a half.
Okay. And about, on a scale of 1 to 10, how would you rate that relationship of yours?
I'd say 10.
Good, that's awesome. Love to hear it. You ever had anything significant happen in your life recently, have you?
No.
Okay. And I'm going to list you off some more things about family history. Please respond with yes or no if anybody in your family has experienced this. Asthma?
Yes.
Okay. Mom or dad?
It's actually my grandma.
Oh, okay. Aneurysm?
No.
Brain tumor?
No.
Cancer?
Yeah.
What type?
Lung.
Okay. And what family member?
Both my mom's parents.
Okay. Diabetes?
No.
Epilepsy, seizures?
No.
Headaches?
Yeah.
Okay.
My mom.
Heart problems?
No.
High blood pressure?
No.
Kidney disease?
No.
Lung disease?
No.
Migraine?
No.
Multiple sclerosis?
No.
Psychiatric disease?
No.
Stroke? Or thyroid?
Nope.
Alright, and then this is just some more general health. Some of these questions are going to be on repeat, but just to make sure that we're clarified.
Okay.
So how would you rate your overall general health, good health? Have you had any recent weight changes, loss of appetite,
I'd
fatigue?
say I'm in good health.
Okay,
Other
good.
than my ankle and pain.
Okay. And allergies, do you have any besides?
No.
Okay.
Just that. Yeah.
No food allergies?
No.
Alright. And for your ears, mouth, and your throat, you haven't had any issues with your throat or earaches, loss of hearing, deafness, smell, or anything like that?
No.
Awesome. And your eyes, do you wear glasses?
I don't.
You don't have any blind spots, blurred vision, or anything like that?
No.
For your gastrointestinal, so your stomach area, have you had any blood in your stool or constipation, nausea,
No.
really bad stomach aches, painful bowel?
No.
Good. No vomiting?
No.
And your urinary, you haven't had blood in your urine? Your periods have been okay?
Mhm.
You haven't had any pregnancies?
No.
No miscarriages?
No.
Awesome. Have you had any difficulty during sex? I know it's a private comment.
No.
Okay, so your heart and lungs, you've had good heart, blood pressure, and cholesterol and everything like that?
Mhm.
Your muscle and joints, have you had any issues other than your ankle?
No.
Your neurological, have you had any, facial drooping, injury to the brain or spine, blackouts, loss of consciousness?
No.
Alright. And you said you have not experienced any depression or anxiety or even have had an eating disorder in the past?
Correct.
Awesome. Pulmonary, you don't have any asthma or blood in your cough or cancer?
No.
Okay. Skin, you've not had no rashes or sensitivity or hair loss?
Sometimes I get a rash in the sun if I'm out there too long.
Okay. About how long does it take for you to get that?
Couple hours.
Okay. And as far as sleeping goes, do you snore or you sleepwalker, nightmares, night terrors?
No.
Okay. Did you sleep well or do you sleep well?
Most of the time, yeah.
Do you feel really rested when you wake up?
For the most part.
And do you fall asleep during the day at all?
I take a nap sometimes, but not like unintentionally.
Yes. Alright. So now that I got all that, I'm gonna come over and take some of your vitals.
Okay.
So I'm gonna check your blood, oxygen saturation. You don't have any nail polish on there, so we don't have to worry about any air. Really good, you're at 99. Next I'm gonna take your temperature. It's on the right setting, so I'm gonna have you open your mouth, put this behind your tongue, make sure not to bite with your teeth. .7, that's a really good temperature, and then I'm gonna dispose the cap and place the probe back in. Next I'm gonna be taking your blood pressure. So I'm gonna use the two-step process. Does that feel okay?
Mhm.
Alright, so your blood pressure is gonna be 102/69. And after each use of my equipment, I'm gonna clean it and sterilize it. Always make sure to use hand sanitizer when you're touching it and you're going back with your patient. Next, I'm gonna take your pulse and your respiration rate. It's gonna take a few minutes. You just need to relax. Okay, so her heart rate is 62 and her respiratory rates are 14, so both are within normal ranges. I'm gonna perform hand hygiene one more time. And then I'm gonna get a little bit more information on that pain just to make sure I can give a good report for the doctor. So once again, you said it was on your right ankle.
Correct.
Okay. And you said it wasn't so much of a stabbing pain?
No.
Okay. And have you tried any, like, ibuprofen? Have you iced it, elevated it?
I've taken some ibuprofen and then I've tried to like not walk on it if I can.
And it hurts when you walk on it?
It does, yes.
Now when you're on it and when it's hurting, does the pressure feel like it's spreading anywhere?
It goes up my calf a little bit.
Okay. And on a scale of about 1 to 10, what would you put that at?
I'd say like 6.
And what's it at when you're just kind of laying down and relaxing?
More like a 3 or 4.
Okay. Do you think you broke it, or do we think we're here for a sprain?
I think more of a sprain.
Okay. All right. Well, I'm gonna make sure to make note of that so the doctor's more aware. Okay. So also while I was taking the health history form, I was taking her general assessment. She had really good coloration. She was very coherent. She responded to the questions very easily and didn't seem to hesitate past the normal amount of time. She has really good hygiene, so that means her living situations are probably okay, and her overall mood was really well. So I didn't see any signs of depression or anxiety or anything to be worried about. So, okay. Before I go, I just want to make sure that the room's good for you. Your bed's all the way down on its one setting. You got both your bed rails up. Here's your call light. So the red button's how you get a hold of me. The rest is to get your TV. You're not a fall risk, so I'm not going to set your bed alarm. And there doesn't seem to be too much clutter. Here's your bedside table. Let me get this paperwork out of your way. And is there anything else I can get for you before I go?
I think I'm good.
All right, I'm going to make sure the doctor comes back in and has all the information he needs.
Thank you.
Mental health. Alright, hi there, I'm Kaylee. I'm going to be your nurse. I'm just going to ask you a few questions, just kind of do a little mini thorough examination. Can you tell me your name, please? Madison Jackson. Okay, Maddie, and can you tell me your date of birth? 5/10/2000. And how many years of schooling have you had completed? 13. So you stopped as a freshman in college? And can you tell me today's date? September 17, 2019. Okay. And once again, what is today's date? September 17, 2019. What's the month? September. What's the year? 2019. What's today's day of the week? Tuesday. And what season is it? Fall. Yes. And do you know where you are right now? I'm in the NLR suite. Okay. And what room is this? The NLR suite. What city are we in? What county are we in? Monroe. What state are we in? Alright, I'm going to say 3 words and I want you to read them back to me. Ball, flag, and tree. Ball, flag, tree. Alright, and I'm also going to have you start from 100 and count back by 7, and then stop after 5 subtractions. I'll let you know when to stop. 93, so 193. 86. 79. 72. That was 5. And then I want you to spell the word world back to me. What? I would like you to spell the word world backwards. Okay. L. R-O-W. And can you say those 3 words that I just told you earlier back to me one more time? Ball, tree, flag. Good job. And what is this right here? Watch. And this? Pen. So will you repeat this phrase back to me? No if, and, or buts. No if, and, or buts. And then I'm going to give you a piece of paper and I want you to fold it up and put it on the ground for me. Good job. And I'm going to write something on a piece of paper and I want you to do the action. Not say it back to me, but do it.
I've like woken up and like panic getting ready for school. I'm like, I'm so late.
So will you write a sentence on this paper for me?
Class prior to this. So after the physiology? Yeah.
And then do you mind redrawing this picture for me? Really good. Awesome. Thank you, Maddie. You did a very good job.